everybody. Good afternoon. A pleasure to be with you and a pleasure to respond to the Premier's remarks and to know that the province is in better shape than initially thought about, which is absolutely very, very important. And what it means that what was done by Ontarians and what was done by the province and the hard times that we have had on being and staying at home is working. The future, though, doesn't only depend on those of us that were able to stay at home. And this is what's very important to understand. There seems to be two models going on here. A model that was very good at predicting COVID-19, requiring hospital intensive care units, the ward beds, the staff for them, even the ventilators. For that, the model works very well. Where the model has not worked well, and nor have we as a society, is on our vulnerable populations. You all know that the outbreaks in nursing homes continue to increase at a rate, at least today, less than before, but nonetheless continue to increase. Almost 50% of the lost lives are lives of residents in nursing homes, residents that we said to their families that we wanted them to stay to stay away from the homes so that we could protect their loved ones. And it is the feeling of RNAO and of nurses overall that we have not done enough to protect them. That not only we have not protected their loved ones, we have not protected even the staff. To this day, we lack PPE, a word that the world over now knows, and we receive personal protective equipment after an outbreak. What we have been asking is the same that the hospitals have. The hospitals have been following very soon after RNAO requested on March 12th, I believe, we put the first call for universal PPE. Soon after, the hospitals, a week or 10 days after, adopted that strategy. But the homes to this day, for the most, do not have universal PPE. They have the PPE after an outbreak. The second community that we have issues with is, of course, people that experience homelessness. Those individuals need, again, the protection that is necessary in terms of PPE and in terms of testing. And I will speak about testing in a minute overall. The third population is our indigenous brothers and sisters. We all know the conditions in which many live, social determinants of health, poverty, far away. We cannot wait until they have outbreaks to ensure that they have actually on site the basics of surgical mask for universal use of surgical mask, universal, everybody. So we can protect them from transmitting one to another if they're asymptomatic, which we know today it's quite easy to be transmitted. And then there is, of course, our people that live in corrections, and that also are individuals that live in extreme crowded situations that we need to support, as well as any other populations that live in confined spaces. So three things again. Personal protective equipment so that we protect our communities our seniors, our nursing home residents, retirement home residents, people that live in shelters, people, our brothers and sisters in indigenous communities, people that live in corrections, and people that live in other confined places. The perfect example was Participation House. And then testing. We have been asking to ramp up testing significantly. And I know that the Premier is also frustrated by that, and that's a good thing. We want a Premier that is frustrated, a Premier that pushes forward, and a Premier that alongside with nurses says not good enough, we need to produce it now. Our understanding is that those tests will come only in the first or second week of May, not before. Hence why this is critical ahead of having the testing for universal testing. We should be doing universal testing in all of our indigenous communities. We should be doing universal testing in all of our shelters. We should be doing universal testing in our nursing homes and in our correction facilities and other confined places, simply so we do surveillance and we protect people and we see what's going on and we don't go in the blind. If we don't, we will find ourselves sooner rather than later, not only with more lost lives, but also we will find ourselves with faster with the second wave and the third wave and so on. Because when people try to compare what the good news in Ontario to South Korea, that's not a comparator. South Korea, let's remember, did massive, massive testing. So this is the example we need to take forward. Massive testing, not only for clinical diagnosis, but for surveillance. And we need the PPE, and we need the isolation when it's necessary, and we need to be very thoughtful about the moving forward when we open the doors to more back to the past, and what do we take back to the past and what we don't. Let me open for questions and respond to your questions. I don't know if CP24 or CTV or Global. I see all of you online. If you have any questions, by all means.
Hi, Doris. It's Antonella Artuso from the Toronto Sun.
Hi, Antonella. How are you?
I'm well. How are you?
I'm good. I'm good. I will be better, and you too when this is more calmer days, right?
Absolutely. I wanted to ask you about PPE in the nursing homes and other long-term care settings. The staff there has been talking for quite a long time about the lack of PPE, and individual staff people have said, well, when we asked our own managers about it, they said it wasn't required. Do you think that they waited too long to make it mandatory? And do you think it was simply a numbers issue? They just didn't have the equipment and they were trying to ration it across an entire system?
Such a very good question, Antonella. When we put the first call ahead of anyone on universal masking, we actually, Antonella, said that we needed to start with nursing homes. And I will tell you the rationale for that. We knew that residents of nursing homes, because of their condition, because of their compromised condition and comorbidities that come with age, we knew that they wouldn't have the same chance to life, even if ventilators would be available for them, which we didn't know if there would be enough ventilators. Now we see there are, but we knew, and we know even today, that to put an 80-year-old or an 85-year-old in a ventilator, it's a lot of suffering, and most of them will not make it. So the only then protection, given that there is no vaccine, is this: to keep the virus at all costs out of the home, right? This is why we're self-isolating, all of us, right? No different. This is their home. So yes, we started late, regrettably, and we started late also with testing. Another point, Antonella, to this day, we only report on death in nursing homes and retirement homes of residents that have been tested positive. As you know, Quebec, UK, several other countries, US included, are also reporting on clinical COVID positive, meaning people that is believed that they were COVID positive even though they were not tested. Another place where you can see the same reporting that is different here is when you receive the report that has the number of people in ventilators. There are two groups on that. There is the people in ventilators, well, there are three groups. People in ventilators that have nothing to do with COVID, right? Usual people that have been in ventilators after certain either procedures or a massive stroke, etc. But people that are COVID tested positive, and then people that are COVID suspected. Those people do not get reported to you. I know how many they are. And those are actually a much larger number than the people that are COVID tested positive. And if those individuals die, the others, I am not sure, and I have asked a couple of times if they get reported as COVID death, and I'm afraid that's not the case. So there is an issue of data openness, and in my report tomorrow, you will be seeing some of that. I was waiting to see if the Premier will announce some new information about reporting, but I will be speaking about data access for everybody, because data is critical to understand, to take the pulse to where we are and what next we need to do. But in relationship to your original question, did we start too late with universal masking? Yes, the answer is absolutely yes. Not only we started late, we only do it for after outbreaks, and that's insufficient, because even though the directive now is universal masking for everybody in nursing homes, they don't have necessarily the supplies. This is also why, Antonella, we see a lot of staff from nursing homes that either are ill, one that we lost, a PSW that we lost, sadly, tragically for the family and for all of us, and then many in self-isolation, and some others that say, I'm not coming back, because remember, they work in 3 places. They earn, if they are now allowed to only work on one, unless they were up to full time, they don't have enough income. And on top of that, to put yourself at risk because you don't have PPE, this is why we have a shortage of staff in nursing homes. Way more is because of PPE than because a real shortage on staff.
Thank you.
Thank you for the question. Any other questions? Global, iPhone, I see a lot of you there. And your questions are always very insightful and interesting. Sean, I see Sean is there also. Okay, I'm going to go each one. CP24, any questions, just in case? Or CTV? Sean Jeffords, Global. Jack. Dave. Julie. Well, I guess no more questions. Is that the case? Okay, so the focus again for us as nurses is to stay the course in relationship to the improvements and the gains that we have made in relationship to those individuals that require hospital care, and be ready just in case there is a surge and we are ready. Remember, we have be a nurse. We will never be short of nurses, including not of critical care nurses or ICU nurses. We have them ready to go, and RNAO has had them from day one of this ordeal. And really, we are absolutely urging once again the Premier, Minister Elliott, Minister Fullerton, to please pay attention to all congregate settings, especially nursing homes, retirement homes, our shelters, our people that live in corrections, our people that live in group homes, our people that live in other type of supportive housing, for example. All of that, and of course, our indigenous people, that this is our time to make justice to people that we have done as a society so much injustice. So let's be there for them. Let's make sure that we have, as the Premier said at the last press conference when he released numbers, let's make sure that the last chapter is a better chapter than otherwise. Every life saved is a life saved for their families, for their communities, and for all of us as society. So let's keep pushing forward, and let's keep staying at home to do our part. But for government, please do your part in sending the adequate supply of PPEs, the adequate supply of testing kits, so actually we can do prevention, not only intervention after outbreaks. Thank you so much.